everyone. Welcome back to another live stream. So today, guys, is gonna be a workout video. So I hope that you're ready. I hope that you're gonna also try to do this workout. Maybe not now, but in the future. And yeah, so I'm just setting up everything here on the computer, so you guys can actually. I can just look at the chat, especially because, like, unfortunately, because otherwise I just can't read it on the computer. So BTDJL, hi and welcome. And yeah, it's been a pretty long time since my last workout stream, so why not? How's your day? Thank you. I'm have a pretty nice day. Pretty relaxed now that most of my university things are almost over, because like I'm almost graduating, so there isn't much else left to do. Just finishing the details of my written elaborate that I did, and yeah. So I hope that you have also a nice day. Thank you for watching the stream, and nice. It's good to hear that you're fine. And now today is gonna be, as the title says, a posterior chain plus a postural routine, because of the fact that we're going to train most of the muscles that are going to belong to our back and to the posterior chain, that we could call like the upper back, right? The neck, upper back, lumbar back, glutes, hamstrings, and calves. So this is like the whole posterior kinetic chain, and we're going to do a lot of different exercises today that are gonna be training and targeting these muscles. So yeah, I'm gonna just move this one right here. All right, so let's go. I'm gonna use today, so I hope that you can see from that part, the phone. I place it in a way that like the room should be more visible. If anything, I can always move it, so let me know if you guys can see everything. I will be using as my assistances just an elastic band here, a rubber band that's going to be like medium, alright? So it's not super strong, but it's not even very thin like my other red rubber band. This is very, very light. This one, it's pretty strong, so I'm going to use this one, and then I'm going to just use this towel just to be able to slide better on the floor, and that's it. So and also I'm going to be using these 2 kilogram dumbbells, all right, that you can see right here, and yeah, these dumbbells are going to be I'm going to be mostly using them for my upper back, especially for the lower traps, and for my low back, as I'm going to do different exercises. So yeah, these are going to be the 3 things I'm going to be using. The other part of the exercise is going to always be done like with gravity, right? Exploding the floor, exploding something like a bed or a sofa, or exploding the wall. So all things that we should have in our houses, in our homes, or if you can go to gym, into gym, you should be able to find these things. And yeah, so first of all, I'm gonna do just a very quick routine that is gonna warm up, right? So and once again, because I'm gonna be training most of my body, because I'm gonna be starting from my spine, right? All the spine, then the glutes, and then the lower legs, right? I'm gonna be just doing some very global motions, like jumping jacks, that can be used as a means to be able to warm up the entire body, so both the upper and the lower body. So yeah, that's what I'm gonna do. So let's just start with this. All right. Do you have any workout apps on your phone? BTDJL is asking on the chat. I don't. On my phone, I'm just using a, how it's called? A calendar, like kind of logins where I just, every time I finish a workout, I just write down like which exercise I did, how many reps, how many sets, the type of exercise and all that stuff, but I don't have any workout apps. So I just, most of the exercises I'm gonna do are gonna be very common exercises that you guys might also know. I'm gonna just adjust them to my level, and I'm gonna just adjust them to the amount of reps I can do, the amount of sets I can do. So, all right. So let's take here the rubber band. All right, and now let's do this. So here you can see that the rubber band, I'm placing it between actually at the side of my feet, so that if I lift up one feet, the rubber band wants to do this, see? So what I do from here is that I just try to push towards the side, and I just take a step, and then I go again. So I just do this. So I'm actually pushing against the rubber band towards the side, and this is a pretty good warm up for the abductors of the hip. So that we're gonna also be training today, because the main abductor of the hip is the medial glute, and therefore it's one of the 3 glutes that you always have to train whenever you're training the posterior chain. All right. So sorry if the image goes, like the lighting of the image changes. That's something from the phone that I cannot disable. So like you can see that the phone takes more light, less light. So it's like, I don't know, it's very weird, and I try to disable it going into the settings of my phone, but I just can't. I don't find a way to disable it. And it's like an auto kind of lighting thing, and yeah, it's very annoying. And when I'm live streaming, I can't like click on the screen so that it makes the phone focus one part, right? And therefore it doesn't change any more the light. So yeah, just unfortunate. Okay, so here BTDJL says, I've started to be trying to lose my fat and don't know any apps, but have a calorie counter to keep track of my health. Okay, I just realized in Blue City Battles there are a lot of runners. Okay, well actually, if your goal is trying to lose body fat percentage, so you're trying to become a little bit more slim, the best rule is always like, if you like, don't go into any kind of weird diet, try to keep your nutrition in check, but don't do unnecessary things like taking out, for example, carbohydrates, or just eating some kind of foods. Just try to eat everything, all right, just in the correct quantity. So if you're eating too much, try to reduce maybe how much you eat. Try to always like eat plenty of vegetables, plenty of like protein, or plenty of stuff like fruit, and things with fibers, because normally those things are not very high in terms of calories, but you can eat a lot of them, so you can feel full, you can feel satisfied. So that's one quick tip that I can give to you. So if you want to try a diet, you can try it, but it's always best if you are being followed by like a professional or some like nutritionist that can really tell you exactly what to do, what not to do, because otherwise you just risk of do it by yourself, you know, you ruin your health because you don't eat enough, or maybe you don't eat the correct foods. So yeah, that's something that you never want to happen. So make sure that you know, you don't you try to check to keep your nutrition in check, eating everything, but just eating the correct quantities, and eating especially more quantities of like vegetables and things like this, and eating maybe less of like sweets, less things that have a lot of fats, or not so many like for example carbohydrates, right? Try to limit the amount of those, but don't stop eating them, right? So it's always good to, like, if you want to eat ice cream, it's okay to eat it. The important thing is that you don't eat it each day, right? So it's not about like having cheat meals or stuff like that. Try to always keep on eating whatever you want, but try to control yourself and check yourself how much you're eating of that. So of course there are some things that you can eat very little amounts. For example, alcohol, right? Try to avoid it. If you have an age that you can drink alcohol, try to avoid it, or like as much as possible, right? But if you're gonna go out with your friends and you're gonna drink a beer or something, you can do it. Of course, it's not like it's gonna completely ruin your health, but of course don't do it so much. Don't become drunk, or don't drink a lot of alcohol like every weekend. So try to always, you know, control yourself in these little things. Sleep well, drink a lot of water, plenty of exercise. A very important part whenever you're trying to lose body fat percentage is not just the nutrition, it's also your workout. So how are you spending your calories? Are you using them when you're working out, when you are, you know, doing some exercise? And that's the very important part. So depending on your goal, you might want to do different exercises, but the exercises I'm going to show you today are going to be very, very important for you to have a good posture. You know, the postural routines, these postural muscles are something that not a lot of people train or like to train because they're very small muscles, right? So you can't show them off. You can't, I don't know, like show them, right, to others. They're not aesthetical, but they're very important for your posture because they can improve the position of your head, the slouching shoulders, the rounding shoulders. They're gonna correct your pelvic tilt, how much pressure, how much low back you're using every time you're doing any movements. And therefore it's very important for you to do these exercises, like at least once in a week, to do a postural routine to keep your body in check in this way. So yeah, I hope that was helpful. And let's keep on going here with the warm-up. So I'm gonna do right now is gonna be what's called another like warming exercise for the hips and for the medial glute. That is the hip drop. So in the case you place a hand on the wall, you let your hip drop like this, and then from here you're trying to push like as you would want to hit the wall with your other hip. Like you're pushing through here like this. Boom. Alright, so you're not like moving your trunk, you're not doing other exaggerated movements, you're just trying to move your pelvis, trying to really push towards the wall. So you let it drop and then you push, let it drop and then you push, like this. This exercise seems banal or seems pretty silly, but actually is one of the main functions of the abduction, because in this case it's going to be abduction in a closed kinetic chain because your foot is on the ground, it's not going to be on the air, and therefore it's much more effective because it lets you activate the muscles in a different way. And the closed kinetic exercises, kinetic chain exercises are so important for any like athletic movement. So let it drop and then push it. And once you reach about 30 of these, you're gonna start feeling a burning about here in the hip area. And if you do that, then that means that if you feel this burning, that means that you have done the exercise correctly. And now I'm gonna just do it on the other side. So again, here is gonna be on the side, but you can see that I'm letting my hip drop and then I'm pushing towards the wall. always try to stop a little bit when you push, stop slightly with the full contraction, and then just keep on going. All right. Okay, I think that should be enough. So yeah. Now let's start first with the posterior chain. I'm gonna start first with the big muscles, and then I'm gonna just show you some exercises for the postural routine. Remember, these exercises for the posterior chain are always gonna be postural because of the fact that as we spend many hours in our day sitting, right? You can see that here we have hip flexion. We sit back, many times we round the shoulders, and we sit with a flexed lumbar spine. So we're sitting like this on the computer, when we're watching TV on the sofa, even if we're reading something or studying, we spend most of our time like this. So you can see that here we have knee flexion, hip flexion, lumbar flexion, everything is flexed. Like from the top, from the neck, from the head, is flexed towards, like everything is flexed. And therefore, you're gonna see that all these exercises that are for the posterior chain are actually gonna extend. You're gonna extend the neck, you're gonna extend thoracically, you're gonna extend your lumbar spine, you're gonna extend the hips, and you're gonna also extend, in this case, against eccentrically, you're gonna extend the knee. So you're gonna be training the extensibility and the flexibility also of the hamstrings. So that's why it's so important doing this postural root exercise, because they're gonna like directly target the huge amount of time that we have these muscles like this flexed. So we have these muscles stretched out. All right. So the first exercise I'm gonna show you. Sorry, I gotta go soon. Oh yeah, don't worry. Thank you for having watched the stream, and thank you for your question. I hope that what I said was helpful for you. So yeah, have a nice day. So we're gonna start here. The first exercise is gonna be an exercise using the wall, all right? And it's gonna be a glute and hamstring activation exercise. So you're gonna place yourself against the wall like this, all right? And then from here, you're gonna just try to push the wall and to push also your hips as high as possible. And then down. We're gonna do it 10 times with both legs, like this, all right? All right. And then you can start doing it one leg each time. So you place yourself again in the wall like this. You lift up one leg, all right? And then you try to do the same using, in this case, one single leg. So trying to push the pelvis as high as possible. And then you go down. All right, let's change legs now. All right. So with this, we have started to activate a little bit the glutes, the hamstrings, also the low back, because these three parts, these three muscle groups are gonna always work together, trying to extend our hips and trying to extend our trunk. So now we're gonna just keep on going here. Actually, I don't know if you guys can see. So I'm gonna try to move the phone. Yeah, here we go. All right. So you guys can see the ground. Actually, you can see the ground. Overkill, hi, welcome. So we're gonna just keep on going here with the exercise on the floor, and we're gonna just take a look now at the, once again, another exercise, in this case, down on the floor, closed kinetic chain. We're gonna go up with both of our legs, right, like a glute bridge, right? You're gonna just push up, and then from here, you're gonna try to extend as well your low back, then abs, and then down. So first of all, glutes, then low back, and then down. All right. So it's like a three-step kind of motion right here. So glutes first, low back, go back to just having your glutes, and then down. This is something very, very important because of the fact that most people, when they train the glute bridge, they don't activate correctly the glutes. The glutes should always activate before you activate the low back muscles. What would they do is like they activate right away, they do something like this, right? I don't know how many you have seen doing like this exercise like this. So they activate right away the low back, and that's wrong because that's biomechanically you're using more muscles that shouldn't be needed that much. So it's always better to activate first the glutes, then the low back, then you go back to only the glutes, and then you go down. So I'm going to try to show you here from the side so you guys can have an idea. I'm sorry, the room, it's pretty small. So the room is pretty small, so that's why it's hard to explain things correctly. And Monkey C, hi, welcome. So I'm gonna try to show you what I mean here from the side. So look here, look at my hips. Okay. So I'm activating first the glutes. See, so I'm keeping the abs tight. Now I'm activating also the low back muscles. So look here what happens. See? Then I'm going back. So I'm activating again the abs, and then I'm going down. So it's like a three-step process. So first glutes, then low back, then back to only the glutes, and then down. All right? So this is biomechanically, this is the correct pattern. So this is how you should be doing your exercises. Glutes, low back, glutes, and down. All right. So I hope that it was clear to you guys how to do it. And yeah, working the glutes, it's very, very important, not just aesthetically, but because these muscles are so important for your posture and also to prevent low back pain. Because if these muscles right here don't work well, your low back muscles and your hamstrings are gonna be so much overloaded, you're gonna have to do so much more work that you might risk developing tightness and developing low back pain. So that's why you should always train this the glutes. They're so important, especially the gluteus maximus, but also the abductors and let's not forget the internal rotator, the gluteus minimus. I strained my back yesterday during Vipers. What is that? What is that exercise? So yeah, if you have strained your back, you probably are in an acute inflammation of pain now. So the best thing is like applying ice trying to, you know, rest or not really training hard, you can still train, you can still move. Try not to rest completely, always try to move, but definitely don't do any kind of, you know, big exercises. When you extend your back, you extend your back, okay, because there are many exercises with that. So yeah, I'm not entirely sure. I've got the exercise that has caused you the pain, but when lying flat on the floor. Oh, right. So I see. So it's this one. It's this one right here. When you like lay down, and then from here you're trying to do this. It's this one. The exercise is this one. Because if it is that one, that means that you have missed exactly like what I was trying to show in the other exercise. You have missed that. You probably are using too much your low back muscles over your glutes, and therefore you are putting them at risk of getting injured. So always make sure that you activate first glutes, you contract them, and then you activate the other muscles, because they work so much better when they have already the huge foundation done by the glutes. So yeah, that's the exercise, right? Okay, yeah. So the exercises I'm actually showing today, you can still do them even if you have a strained back. If the pain, you know, is not very high and you don't have any other problems, you can still do this exercise very, very gently, very slowly, trying to see, you know, if the pain doesn't increase, or, you know, stuff like that. You can still do these exercises. And yeah, they're gonna actually probably help you to activate more your glutes, because you are likely lacking some activation of the glutes, or maybe some strength, some real strength in your glutes, and therefore your other muscles are trying to compensate, and that's why you have finished straining them. Of course, if you strain the muscles doing a very heavy lift, probably that is because of the fact that the lift is just too much for your strength, so that's another part. But if you strain yourself doing a bodyweight exercise, that probably means that biomechanically you have something that is not working correctly, and that's why you ended up straining yourself. So make sure that you train very well your glutes to make them stronger, to make your brain know that it must activate first the glutes and then everything else. So yeah, that's just very important. I'm gonna now show you another exercise. In this case, it's a little bit more advanced, a little bit harder, let's say like that. But once again, it's something involving hamstrings, glutes, and the low back. And it's exactly as I said this is before, but we're gonna just do it one leg at a time. So we're like this, right? One leg is up in the air. The other leg, push first, glutes. So first is always remember the glutes, then low back, then you go down, and then you come down. So it's exactly as before, but we're just doing it one leg at a time, so there is more weight. I'm gonna do about 10 reps, I think. All right, and let's change legs now. All right, last one. All right, nice. So I feel now very warmed up. So here, yes, I only have minimal amount of glutes, low. Okay, but it wasn't too bad because at the moment I knew something didn't feel right, so I stopped. All right, yeah, that's actually pretty good. Thank you for posting these videos, very motivating and educational. Nice. So yeah, that makes me happy, and that's exactly why I upload, these videos. Because like I'm gonna graduate as a physical therapist in like 1 month, a little bit more than 1 month. So I've studied this stuff, and it's very common, and that's why there are so many little tricks, little things that you can still do even if you have no pain or you have injured yourself, especially if there isn't like a serious cause behind the pain, and you can always try to educate again your body to move properly, because that's exactly what happens. Like 90% of times when you hurt yourself in any way, your body tries to find ways to compensate so that you don't have any more that pain, you don't feel it. And unfortunately, many times the compensations are wrong, or they're gonna be placing yourself at the risk of having another injury or another like more pain developing after maybe years. So it's always important whenever you're trying to rehabilitate yourself to like go to the basics, and to first, like after you have been able to reduce the pain and all the things, you need to educate your brain especially to use your body properly. That's why the first part of any physical therapy intervention is actually re-education. You have to educate again the patient to move properly in order to be able to understand what the muscles are, how to activate them, how to do the motion correctly, and then only then afterwards you can start increasing, for example, the strength, the difficulty, all that stuff. But the first part, it's the most important one, because you need to teach again to that body how to move properly, and that's the hardest part, because at the beginning no one really knows how to move the scapulas, no one really moves. Okay, but how can I activate the glutes, right? How can I feel that I'm activating the glutes? No one knows that, because like we spend so much time ignoring that the parts of our body that we can see, that we just don't have a good mind muscle connection. And that's why it's so important at the beginning, really trying to focus on these very small details, teaching how to move properly, and from there you can start adding strength and so on, but that comes afterwards. Mr. Pro Player, hi, welcome. All right, so I'm gonna now start the real routine. Right now it was just some bodyweight exercises, all right, just to warm up the area. Now what I'm gonna do is I'm gonna use this bed, right, as an elevated surface where I can place my back, and therefore I can create more hip flexion, and therefore I can move my glutes, my hamstrings, my low back in a larger range of motion, especially the glutes. So yeah, I'm gonna move right here. All right, you should be able to see. Ooh. All right. So see that here my back is up here, and therefore if I go down with my pelvis, look at how low I can get. See how much hip flexion I can get here? Much more than on the ground. And therefore that's why it's so nice training with this. And from here you just wanna, like, again, push, always trying to activate your glutes. So down, and you push, activating the glutes. You push, activating the glutes. You don't want to do this. I'm going to just show you here the bad version. Alright, doing this is just straining once again your low back. If you do the hip bridges or the hip thrusts, right? If you can put any weight, if you do it like this, you're straining your low back because you're using most your low back to do this exercise, right? So you don't want to do this. You want to always concentrate on activating first the glutes, keeping your abs tight, right? And trying to really squeeze the glutes right here. If you do that correctly, you're gonna see that it's very hard to get past this point, because from here, that's where you need to use the low back, but you need to activate it afterwards. So first, the glutes, and then if you want, you can go a little bit further using your low back, but you have to first use your glutes. And in this case, because I'm just targeting my glutes, I don't care about the low back. So I'm gonna reach here, and then I'm gonna go down. And if you want, you can use some weight, right? You can place some weight right here on your hips so that it's harder to push up and you have more resistance, right? But the important thing is that you always are using your glutes, you're keeping your abs tight, you're keeping a posterior pelvic tilt, and you will stop right here. So you don't go any further, because if you go any further, you'll start using your low back. Now you can actually make this exercise also to target the hamstrings by just placing your feet further away. So in this case, you can see that the degree of knee flexion is less, and therefore you are activating more. You can activate more the hamstrings, and then from here, if you just do the same exercise, all right, you're also pushing and using a lot of the hamstrings, especially if you're like in this position. And for example, here I'm using a lot of my hamstrings, and I can even feel it. Even if, once again, I stop when I go up here, because I don't care about using my low back. I'm just care about my glutes and my hamstrings in this case. But even here, I can really feel that I'm using my hamstrings a lot. Ouch. Yeah, even my calves, I can really feel like I'm using also my calves, because remember that the gastrocnemius, that is the calf muscle, the main calf muscle, the main dynamic muscle of the calf, is also a knee flexor. So you're gonna also activate that one. Here I'm sliding. Okay. Alright. And here I've done already a lot of these body weight exercises, right? I've already probably done 20 reps for each. So I'm gonna just stop now. I'm gonna take my time, I'm gonna rest a little bit, and if you want, you can add weight, as I said before. So what I'm gonna do here is I'm gonna have these extra 4 kilos from these dumbbells, and I'm gonna just add them on top of my hip to have that extra weight, right? Just to make the exercise slightly harder. Okay, so here there is a long comment. Working in the hospital, I found out how valuable physical therapy is. I used to think it was only for orthopedic patients. I don't know how it works in Europe. Do you join a program after graduating? Thanks for asking. It's a very interesting question. Now, physical therapy can be used for any rehabilitation. So not just orthopedic. So if you have problems to the bones or muscles or ligaments or tendons, it's not just for that. It's also for all the neurological part, because many times people that suffer, for example, medullary problems or brain problems, like for example after a stroke, they have certain aspects that are called motor aspects, right? That are just the fact that, for example, they can't move about like half of their body, they can't move it properly, or they have abnormal reactions, they have abnormal like motor responses. And so it's a job of physical therapy to actually try to make the person able to, for example, walk again if possible, or if that is not possible, not achievable, because like the damage is too large, to make the people able to do like how many things as possible. For example, with the upper arm, maybe reaching, grasping, being able to keep as an independent life as much as possible. So physical therapy is all this as well. It's also physical therapy for the lungs, so the respiratory physical therapist, very, very important. And so you see, physical therapy can just be applied to any kind of rehabilitation, not just the classical injury from sports or the muscle injury or the bone fracture, stuff like that. And now in my country, I live in Italy, and here I'm after graduating, I'm planning on like sending my curriculum right to different places close to where I live, and start work. So you can keep on studying if you want, and I will probably maybe in a couple of years I will do like a master, or I'm gonna do like a master degree, or maybe a special course. Just being able to learn more stuff, more techniques, more things. But at the moment, I'm planning on like working, finding a job, and start earning something, because these master courses are pretty expensive, so you can't afford them like right away. And also because in our field, like working is so important, experience, right? Being able to treat patients, to find many different type of patients, learning from like maybe your mistakes, maybe your past experiences. That's very, very important in our job as well. So yeah, that's what I'm gonna do after graduating. I'm gonna probably just look for a job. Physical therapists are very much needed. Like you can find a job anywhere pretty much without too much trouble. Of course, you accept it or not depending on what you like to do. If you wanna like if you prefer like maybe staying with older people, right? Or maybe you prefer staying with younger people, traumatic ones, neurological ones, and yeah, depending on your field, maybe sports. There are many different branches, so depending on what you prefer, you can just choose to apply to different jobs. And yeah, in the beginning it's pretty rough because you have just acquired a degree. It's very hard to find good jobs at the beginning. You always are offered pretty small maybe or pretty jobs, but the important thing is like working your way up there. And once you have some more experience, it's more likely that, for example, bigger companies or like bigger like clinics are gonna recruit you, and you can start working in better environments, bigger, and so on. So that's pretty much the planning for the future. Oh yes, you need a certain amount of hours here. Yeah, exactly. Like a practical here is called tirocinio. That could be like the practices, right? The practical part. I think electrophysiological physical therapist is really cool. I don't know if there were a specialty. You could be like electrophysiological physical therapist, but there are some courses where you can learn, for example, how to apply different instruments. That, for example, TENS. That is like electrotherapy, pretty much, where you use electricity to try to lower the damage that the patient is having, try to treat different conditions, for example, muscle flaccidity, trying to stimulate, the recruitment of the muscle fibers, and so on. You can use electrotherapy in many different ways. And I think like like I could do it, even if I don't have that degree. I think I could do it, but of course it's better if someone that has a specialized degree is doing it. But yeah, it's just like everything you see, you have different parts, different things. All right, so let's just continue here with the routine. I talked a lot, so I hope that you guys are not mad. I'm trying just to explain, some things, because I feel that they're always helpful. Okay, so I have here the two dumbbells, 2 kilos each. So I'm gonna just place them like this, all right? And so in doing this, I'm gonna be able to have some extra weight that my glutes, in this case, need to overcome to be able to reach this position. And once again, remember, just not activating the low back. So I don't wanna do this, all right? I just wanna activate the glutes and then stop there. As much as possible, and then stop there. is always, and as you can see, I'm always like trying to hold the contraction for like half a second and then going down. This exercise is so important to train and to strengthen your glutes that you know, it should be like a must on any kind of, you know, workout or exercise. It should be a must that these are incorporated. All right, let's rest now a little bit, and then I'm gonna do the one for the hamstrings. So I'm gonna have my legs slightly straight up. I'm not even counting here because of the fact I'm talking. I'm not even really counting how many reps I'm doing, but I try to do between like 15 and 20 reps total, around that range. All right, let's go. And in this case, just straightening up the legs to activate more the hamstrings. And again, down and up. Trying to always keep the abs tight and trying to contract the glutes. And in this case, also the hamstrings. You're gonna feel that you're activating the hamstrings a lot. All right, that's it. Oh. So, I'm gonna move on here to the next part. All right. Yeah, I can even do it like this. So, what I'm gonna do now is gonna be, I'm gonna do a superset. All right. So I'm gonna do a I'm going to alternate a little bit more of a glute bridge with a hamstring bridge, and doing it single leg. So let's see how it goes. And I will try to do like 10 reps each leg, switching and then switching back right afterwards. So we'll try to keep on going like maybe 3 sets, superset like this, no stopping, no rest, no extra weight, so just body weight. So let's see how it goes. So the glute bridge should be like this instead of the hamstring bridge. Now right here, I don't know if I have enough room, if I have enough space. Because I'm gonna need to do something like this. So yeah, we're gonna actually move in this other direction. I don't have enough room to show it sideways. So I'm gonna have to show it to you from the front. But you gotta figure out an idea. What am I doing? All right. So let's see. Right, so it's gonna be glute bridge and then hamstring walk, like where pretty much I'm holding the hamstrings and I'm just lifting one leg at a time, keeping my pelvis without touching the ground. Right. So that's pretty much it. Okay, so let's go. Let's start with the glute bridge here. All right, one leg each. So 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Change legs. 1, 2, 4, 6, 7, 8, 9, and 10. And now the walking of the hamstring. So 1, 2, 3, 4, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. All right, nice. Whew. So I'm just keeping here, like with the glute bridge, I'm just trying to keep the knees flexed, so to deactivate the hamstrings, to use most of the glutes. Instead, on the hamstring part, I'm just straining up the legs, and therefore I'm activating more the hamstrings, and I'm just using more hamstrings overall. Yeah, true. Stop. I realized just now. So let's keep on going here with the glute bridge. 1. Let's just alternate it. So let's just do it like this. 2, 3, 4, 4, 5, 5, 6, 6, 7, 7, 8, 8, 9, 9, 10, and 10. All right, hamstring now. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. All right. Let's go back now to the glute bridge right away. Let's not stop as I did before. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Glute bridge now. Hamstring bridge actually. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. All right, good. So I did a total of 3 times, I think. So yeah, that's pretty good. Have you ever woken up in the middle of the night by a calf cramp? That's the worst. Oh no, I've never. That has never happened to me. But I've had some cramps on either my feet or on this part, like on my hamstrings sometimes. I've had some cramps, so yeah, I know that the feeling is very, very unpleasant. So, but at night, never. Like I try always to sleep with my feet like at 90 degrees or slightly lower, but never like completely down. So yeah, that's just it. All right. Now let's start moving on to the larger part. So let's start doing something for the medial glute, and this is where I'm gonna use now this elastic band. So let's move the camera like this. All right, it should be good. I think I was dehydrated. Yeah, probably that had cramps happen when you are either dehydrated or when you're not assuming enough potassium in your diet. So make sure you eat, like especially bananas is like the most common fruit that has a lot of potassium inside. Yeah, try to always, as I said before, eat healthy and eat plenty of different fruits as well, vegetables. And if you do that, you should be able to introduce into your body all the nutrients and all the vitamins and all the important things that are needed for your body to function properly. Now, what I'm going to do with this elastic band, you probably have seen this exercise before. I'm going to just show it to you because I feel like it's a very cool exercise. You're going to grab the elastic band, right? You're going to place your feet close to one another. You're going to just wrap the elastic band around your knees, right? So pretty much ahead of the knee. So for example, for me, this should be it. And then once you reach this part, you want to just tight it, and you're going to just make a knot. All right. This should be enough, so you can see that there is a knot here, and therefore if I try to open up my legs like this, I need to overcome the resistance of the band. All right, so see that the band is pushing my knees inwards, so if I want to keep them straight, I need to actually push outwards. And this once again is external rotation but also abduction. All right, so keeping the legs out. And what you want to do from here is very simple. You want to just take here a stance where, so you take a wide stance, so in this case you have to already push towards the side to be able to resist the elastic band, because the elastic band is pushing your knees in, right? So you have to push out, and at the same time you wanna keep your body into one position, all right? So I'm gonna just show you here two different exercises. It's better, like, I'm just talking too much, really. So, wide stance, flexing the knee, like this, holding. I'm gonna hold for like 30 seconds. So I'm flexing a bit, in this case I'm using a little bit my quads, right? But because of the fact I'm really fighting against the elastic band, I'm really feeling that the pain is coming from my hips, not from my quads. So it's not like my quads here that I'm fatiguing. And I'm trying to resist the elastic band for 30 seconds, and that's it. Whew. So let's take now 30 seconds rest, and then let's go again. So you want to do it like 3 or 4 times, depending on what you want. And yeah, it's very, very cool. Very cool and very easy exercise. Because like you are resisting against, in this case, the rubber band. And you are, once again, in a closed kinetic chain position. So it's very, very good. Right, here we go. So again, in position, and again, pushing out the knees and keeping them out. You guys can probably see from the front how much like the rubber band is trying to keep my knees in, and I have to fight that. So that's why you can see my knees like doing this. Oh. Whew, that was so tough. All right, so let's rest here a little bit. Ooh. Ooh. All right. And let's go for the last one. I'm gonna just do it 3 times because then I'm gonna just show you another variation that you can do. So wet stance, down and keeping the knees out. Ooh. This one is not just for the abductors but also for the external rotators of the hip. Man, it's so hard. Like this knee, I feel like it's giving in. I can't keep it. Okay. All right. So that was the first exercise. Yeah, let's just keep it. So it's like a half squat, right? But it's not very important for the quads. It's like you're trying to keep this wide stance and you're trying to fight the rubber band. And yeah, it's so like I feel these muscles right here on the side of the hips so hot right now, burning, screaming. Whew. All right, I'm gonna rest now for a minute. I'm gonna rest a little bit more, and I'm gonna show you the second variation you can do, keeping the once again just a rubber band around your knees, and again an exercise standing. All right. So now this next exercise, what you're gonna do is you wanna place yourself so that you have enough room to move one leg. I'm gonna just demonstrate it, how it is. So you wanna again like keep the knees halfly flat, so not 90 degrees, so it's not very important that you go deep, right? Just keep them a little bit flexed. And then with the other leg, you are always standing, all right, on top of one main leg, and you're trying to move the other one like this, all right? Keeping, of course, the knees as upwards as possible. Do you ever like doing big weights? No, I don't. I mean, I haven't gone to gym in like probably 5 years, and all I'm doing is being like working with rubber bands, working like this, body weight, and I believe that if you know how to work your own body weight, it's not very important like using weights or barbells or stuff like that. You can train your muscles and you can make them grow even in body weight if you know how to do it. So yeah, it's just my opinion. Okay, so let's go. Again here, halfway flex, and go. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, and 20. Alright, so that was 20, pretty much 30 seconds of work. I'm gonna rest a little bit now, and I'm gonna do the other side. So I'm gonna be standing on my left leg, and I'm gonna be moving my right one. Ooh. So in this case, once again, one leg is holding the whole body, so you need to keep the leg straight, right? So you're working this part, and you're also working the other one because you're moving it out and in. All right, let's go. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 12, 13, 14, 15, 16, 17, 18, 19, 20. Oh man, woo. It's so tough. Oh. This one for your abductors, for your hips. It's such a good exercise. So I'm gonna do just one more for each side, all right? And then I'm gonna do just 2 more exercises, 2 variations on the floor, again for the abductors. And then I'm gonna just move on to the last part of the postural routine, this posterior chain. That is the upper body. So we're gonna train the thoracic extension, a little bit the lumbar extension as well. Scapular retraction, you know, all the muscles in the scapula that help also to keep a better posture. And yeah, I'm gonna just show you very easy exercise to do to train their body weight or with very little equipment, as you can see. All right, let's go. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, and 20. All right. Oh. And then let's do the other side now. All right. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, and 20. All right, that's it for today with this elastic band. Whew. All right. After a little bit, it also starts hurting right here. See, because like the elastic band is always pushing there, so that's the only thing that's a little bit uncomfortable. But other than that, it's pretty good. Alright, so now let's move on to the main exercises. I'm gonna just move the phone here. Alright, so that you can see the ground. Okay. So let's move on to the main area now. That is the upper back. Now, which are the best exercises for you to train this extension of the lumbar spine, the thoracic spine, and the neck. So that are going to be very important muscles for the posture. Now the easy one that you can do right at the beginning, it's one on the wall, right? And you're going to just do it in this case, looking at your. You can even do it on the floor. Or you can just do it on the floor. All right. So let's just take it easy. And you want to just lay down on your stomach like this. All right. And then from here, you're going to activate the glutes, and you're going to just lift up your legs like this. I don't know if you guys can see. I'm going to try to move. I'm going to try to place myself like this. So, you should be able to maybe see better, right? So from here, you're trying to lift up the legs. Here there is a wall, so I can't lay down my legs because there is a wall. Maybe like this, right? So activating the glutes and lifting up the legs. So that's the first thing you always want to do. All right? This motion, activating the glutes and lifting up the legs from the ground. Now, considering that, right, then you want to move on. You want to also activate the low back, and you're going to lift your torso from the ground. Right, so I'm going to have to place myself like this, because otherwise I just can't, I just don't have enough room. All right, so first remember, glutes, legs in the air, and then as you're keeping the legs in the air, you want to lift up your trunk, see, like this. So glutes, legs, trunk, and then from here what you're trying to do is you're trying to squeeze your scapulas together as you really want to show your chest towards the floor, right? So let's go again. Glutes, legs in the air, torso, scapulas, and then chest out. And then here you want to just hold. And stop. So about 20-25 seconds hold, and let's stop. Relax a little bit and then go again. So that's how to first activate all these area. Remember, first glutes, legs, then the torso, so using the lumbar spine, and then you always want to like activate the scapulas so that you always do like a little bit of thoracic extension, and you try to show your chest. So you do something like this as you're holding. And then you hold that position that you have acquired. Keeping the glutes contracted, keeping everything tight. And yeah, let's go again. Alright, so glutes, legs, torso, scapulas, and chest out. Alright, nice. So that's pretty much it, right? Always activate your triceps. You're gonna feel that your triceps are also activated, right? Because you're also extending the shoulder. So you're like extending everything. With this motion, you are placing everything into extension. Now, what you're going to do next is you're going to just progressively, instead of holding the position on your arms at the side, you're going to progressively shift your arms towards your side first, like this, and then like this. And then you always try to hold that position. It's going to become increasingly harder as your arms raise above your head to hold, the position, to hold everything. But this is going to be targeting and training the muscles exactly that are needed for you to keep an extension as you, for example, are moving your arms overhead, or to train the muscles like the lower traps that is a muscle that generally is very weak, but that's a very important muscle for the dynamic function of the scapula, to have a more stable scapula as you're moving it. So let's move on now. I'm going to try to keep my arms in a T shape like this, right? So my arms on my sides as I'm keeping the whole position. So again here, glutes, legs, torso, arms towards the side, and then you want to lift up everything, all right? Again, trying to squeeze the scapulas, trying to really extend everything, but in this case the arms are at the side. And then you hold. Chest out, remember. and stop. So unfortunately here, I don't really have enough room. Like you should have a room where you don't have beds and stuff around you that can limit your movement, of course. I'm just doing this because like I'm doing the video here. I don't have any other spots in my house where I can be, you know, relaxed and I can just live stream. So, but if you can do it in a room that's larger than this, that you don't have anything, that's of course the best. Levathorn, hi, welcome. So you uploaded your video, nice, well done. I'm gonna just I'm gonna watch it after I complete the stream. So let's go again here. Alright, so glutes, legs, torso, arms towards the side, and everything up. Retracting the scapulas, showing the chest, and keeping the position. Alright, and stop. Ooh. Nice. Alright, and now is the hardest one. Now it's the one you're trying to hold, keeping your arms overhead. Now depending on your level, depending on your strength, you might not be able to have them straight up like this. Even like I can't even do it. But if you have enough strength, of course, go for it. I'm gonna probably have my arms like around here, like something like this. That should be good enough for my level. And yeah, I'm gonna have though to move this slightly like more vertical because like otherwise there is a bed there and I just don't have any room. Maybe I can just move it like this. Okay, let's just do it like that. That should be easy. Alright. Let's go. So, again, same stuff. Glutes, legs, torso. Now in this case, the arms up here, and then you try to lift up and to hold. Alright. Woo! That was it. That was the first one. And yeah, I hope that you guys were able to see, you know, the position is slightly different, so I don't know how well you can see, but it's all about like holding that position as much as possible. Alright. So I'm gonna try to do this second one like this, because maybe I have enough room for my arm right there. So let's try. Maybe I can just push myself further away. Yeah, like this. So you can see a little bit from the side, like how it looks like from the side. Alright. Let's go. So, glutes, legs, torso, arms overhead, and holding. Not touching the ground with your hands, not with your face. Alright. Just try to hold that position. Alright. Yeah. yeah. So if you guys see that I'm looking right there, it's because I have the chat and I have the monitor, so I can see your comments. All right, so that's pretty good. All right, and now we're gonna just add some dynamics to the movement. So we're not gonna just keep it static, but we're gonna just do something dynamic. So I'm gonna start first doing it just with my arms, you know, without anything, and then I'm gonna probably also do it with the two dumbbells, right? 2 kilos is not very much, but especially in this overhead position, it's very tough. So if you can't with some weights, you know, you can do even like wall bubbles, something with 1 kilo or maybe less, if you or just body weight. Body weight is already pretty good because you have the whole weight of your arm. All right, so dynamically, all right, I'm gonna just do these 2 different motions. The first one is gonna be a complete circumnavigation, so I'm gonna just do this, all right, with my arms, and especially when I move upwards, I'm really trying also to, like, I'm trying to like push something over my head. So it's not just reaching with my arms above, but also doing this. I don't know if you guys can see the difference, but you're like actively pushing your arms out. So that's the goal. So let's go. Hopefully here I'm not gonna have anything in my way, but yeah, probably I'm gonna hit something that's all right. So I'm gonna do here is glutes, legs, torso, and I'm gonna just move my hands like this. See, up and down, keeping, of course, my torso up. So without touching like the floor, trying to lift it up. And just this angel kind of position, right? When you just move your arms up and down, not touching the floor. And when you go up here, you try to squeeze, and you try to push your arms like this towards the front. All right, that's pretty good. I did it like 8 times, I think, so that's good for the beginning. So let's rest now a little bit. I'm gonna do it again. And then I'm gonna just have the weights. I'm gonna do a slightly different motion because the weights are gonna make it that much harder, but nonetheless able to train, you know, the muscles correctly. So right there, laying down, and again it's gonna be the same stuff. So glutes, legs, torso, and then moving the arms up and down. All right, good job. Now with weights, what you're gonna do with weights now is you're gonna stop training your low back. So you don't have to lift your torso anymore up. You have to keep your head on the ground, right? So you try to, of course, you're gonna activate these muscles because when moving your arms up and down, you're gonna activate anyway the whole posterior chain. But your goal is trying to keep your torso down and try to just move the arms up and down. So in this way, it's more of a scapular exercise, especially for the lower traps. And it doesn't become any more like a lumbar exercise, also extending the low back. All right, so this is the weight, right? 2 kilos. This is what I got. And this is pretty challenging for me, but I still can do it. So always try to do to adapt the weight to your level. And if you can't do it with weight, don't worry, just do it body weight. It's already pretty difficult only with your arms. So yeah, in this case, you're gonna just keep this position, all right, like this. So with the forehead on the ground, like this, your torso down, you're gonna just activate the glutes, keeping your legs out, and then from here, you're gonna just straight down your arms, and back, and down, and down, down. Alright, so unfortunately there was here the bag that was just limiting a little bit the motion, but I thought that you guys were able to see well how to do it. So the important thing is just keeping your whole body down. In this case, you don't want to lift it up, and you're going to just move your arms up and down. And if you can do it with weights, just do it, body weight. Always try to move down, hold a little bit, and then back. So don't do like this and then go back immediately. Always try to do it control, hold a little bit, and then down. Up, hold, and down. So I'm gonna, now that you have seen it from the side, I'm gonna just do it towards the front, so I don't have any more of the bed here in the way, because it was pretty uncomfortable. All right, let's go. All right, so everything down, glutes, legs up, and go. Alright, and I was just already pretty tired, so I wasn't able to do the motion that good. I was very close with the weights on the ground, so yeah, that's it. So that's the last exercise here for the scapulas, for the posterior chain. Now, one exercise that you can do for your head is this one right here. I'm going to show you on the floor, on the wall. So I just put this one like this. All right, here you should be able to see. All right, just grab a wall right here and put yourself against the wall. I'm gonna just it's because I'm very sweaty, so let's do it like this. All right, so against the wall, you wanna just place your feet about like 20 centimeters from the floor, from the wall, and then you want to just move your head until you can touch the wall, right? And then from here, you're going to just breathe out as you try to put your chin closer to your, as close as possible to your torso, but without letting, without stop touching the wall with your back head, right? So like this. As low as possible, but still touching the wall. And then breathe in and down. Keep it. Reset. Out. Reset. Reset. So you want to do it like about 10 times, all right? And the important thing is that I'm going to just place myself in close so that you can see. When you're breathing out, the important thing is that you always touch the wall with your back head. So when you do this, right, don't do it like this, but always try to do this, right? When you're always trying to keep your knee extended, right? So against the wall, but you're trying then to flex it. So it's these two combination of motions that actually are going to make you have a much better position of your neck and are going to help you to relax these muscles up here and to have overall better posture. So like this. And then you reset. You can also do it on the floor if you want. You can just set yourself on the floor and you use the floor to like be the reference, like the wall, and then you just do it on the floor. It's the same. And this is it, because this concludes today's stream. I just want to show you different exercises for the glutes that you can do, for the hamstrings, a little bit for the calves, for the gluteus, for the abductors, all right? And then going into the lumbar spine, the thoracic spine, and then the neck. So all these motions or these movements are very important for the posture to fight the sitting behavior that we have, that we spend so many hours sitting down, so that we keep a good and healthy body, and we prevent especially like low back pain and having any problems on the knees, on the hips, and so on. So yeah, that's pretty much it. I think I said before that I would have done more exercises for the abductors, and at the end of the day, like I forgot and I didn't do it. But yeah, I just hope that this whole video was helpful for you guys to understand a bit more these exercises and how you can do them. And yeah, very little equipment. So yeah, I hope you guys enjoyed. Thumbs up. Thank you for having watched the stream. Thank you for everyone for the comments. And yeah, have a great day. And also for those of you who are gonna watch this stream maybe afterwards, I hope that this whole video was helpful for you. Sorry for sometimes talking too much, but I always like to explain things, and so that people don't just copy what I do, but they understand why they're doing it in the way that I'm showing. So yeah, thank you once again. Have a great day and stay well. See ya. Bye bye.